afternoon, and welcome to Burr News and Views. I'm your host, Don Burgess. And with us today to talk a little bit about COVID is the Health Minister, Kim Wilson. Welcome.
Thank you. Well, thank you, John.
And the Chief Medical Officer, Dr. Ayoola Oyinloye.
Thank you, John.
Okay. Well, I know we only have 30 minutes, so I'll just try to rapid fire through as many of these as we can. And we also have some reader questions we'd like to put to you as well. Start with some of the questions from Burr News. Schools will start with remote learning tomorrow with possible in-school learning next week. What concerns do you have with in-school learning for Bermuda compared to what's happening in the United States?
Well, Don, I think many of the concerns that we have in Bermuda are probably shared with other jurisdictions such as the United States. And it specifically relates to the fact that at this point, children that are under 12 years old are unable to be immunized. And what we're finding in Bermuda with respect to our COVID spike, as we're seeing now in this fourth wave, is that a number of persons that are affected are individuals. I think it's almost 7%, at least minimally, are individuals that are too young to be able to be immunized. So that is, of course, a principal concern, because those individuals that are not immunized are unable to, are returning home, contracting COVID, and then returning home to their unimmunized parents, and the spread continues. So I think the principal concern with respect to that is that issue as it relates to unimmunized children. And then also we need to ensure that persons continue to adhere to the messaging that we've repeated, the constant refrain over the past 18 months with respect to the importance of hand hygiene, wearing your mask and wearing it appropriately, as well as all the other public health guidance that's been presented again over the past 18 months.
Okay. You mentioned 7% couldn't be vaccinated. Overall, what's the percentage of children who are being affected by this fourth wave?
I don't. Oh dear. It looks like the children age groups between 10 and 19. I'm just looking at that. Hold on, Don, because that was one of the questions that we just got. I'm not sure if I'm going to have the answer to that. I can get that information to you, but that was one of the ones that unfortunately just came in insofar as the data. So I don't have that data. I don't know if CMO has it.
If I may, Minister, it depends on how you're defining children, but I can tell you there are about 100 people, active cases at the moment, who are 19 or younger.
Okay, so over 20% then.
Yeah.
Because it's 432. What are the struggles of dealing with the Delta variant?
Minister, if I may?
Certainly.
Okay, right. So the Delta variant, as we have talked about several times, is much more transmissible. It's anything between 2 and 4 times more transmissible than any of the viruses we've seen so far, any of the variants we've seen so far. It's particularly in the young and in the vaccinated, the symptoms can be mild. And a lot of people associate that with allergy-like symptoms. And that means that more people are able to transmit this when they are, before they realize that they're very, very ill. We are in a fortunate position that 65% of this island is already vaccinated, and that reduces the pool of people who can get seriously ill from this virus. However, I did mention this in my interview with BBC, that Bermuda Broadcasting, that this if it gets into our unvaccinated population and spreads within our vaccinated population, it's going to be it's going to really spread, because it is quite transmissible, and that's precisely what we are seeing now. It is quite serious, and the reason why we are not seeing as bad hospitalization as we have in the previous waves is in part due to the proportion of the island who's now vaccinated.
Right. Well, I'll just piggyback off of that. What are the percentages of people who are vaccinated or unvaccinated?
Could you say that again? You faded off for a minute.
Sorry. The number of people who are going to the hospital. We know, like recently, Yesterday's report, it said 12 people were all unvaccinated. But
Correct.
overall, what is the hospitalization situation since the Delta variant started? People being vaccinated and unvaccinated.
Well, so since the beginning of July, when we've started dealing with this, we have seen a footfall of about 45 people in the hospital. To the best of my knowledge, only two of them have been fully vaccinated. Certainly, those who have ended up in intensive care, none of the people who've ended up in intensive care have been fully vaccinated, and certainly none of the people who've unfortunately died have been fully vaccinated.
So 43 out of the 45 have not been vaccinated. Everybody that's been to ICU has not been vaccinated.
Correct.
Everybody who's passed away, sadly, has not been vaccinated.
Correct.
Okay. So, CMO, why aren't we doing antibody testing as people who've had COVID appear to have a better immune response than someone who's had both shots of Pfizer with the Delta variant?
Uh, Several things to unpack from your statement there, Don. First of all, I had an extensive interview and it's extensive talk about this a couple of months ago. The first thing, I'll first of all like to challenge your assumption that people who had some immunity from natural infection have a better immunity than people who've been vaccinated. That's simply not true. Because there are a lot of variables with people who've been infected. The amount of antibodies or the amount of immunity you get depends quite largely on how bad your infection was in the first place. And as I explained the last time, the body's immune system is quite complex. You may not react consistently to all parts of the virus with following infection. However, if you've been vaccinated, that is a defined quantity of the mRNA virus in most instances, and in some cases, for those who've had other types of viral vector vaccines, it's a defined quantity, is measurable, is predictable. We can actually work based on that. There's too many variables to be considered following infection. And to your other point about antibody testing, the antibodies are only a small part of your immunity. No other, they are not a good proxy to tell you whether you are immune or not. There's nobody else in the world who's using that as a proxy. No scientific consensus on using that as a proxy for immunity. So we don't use it for vaccinated people or people who have had infection. It's not very useful.
Okay. Minister, what is the government's position on booster shots, since it seems like the Pfizer vaccine efficacy against Delta is less than 50%?
I'm going to actually yield that as a technical question to the CMO, who's far more equipped to address that issue concerning the booster than I.
Yeah, I'm very happy to take that on, Minister. So again, Dan, I don't know where you got your figures from, but 50% is not correct. The figures we have ranges anything between 70 and 90% for protection for symptomatic disease with any of the vaccines that we've been using at the moment. So 50% is not right. It's not correct. Second thing is about what we're doing about boosters. There is still quite a lot of uncertainty about the booster shots. There's a lot of trials that are going on at the moment. We're pulling all together the information that we know, and the Bermuda Advisory Council on Immunization Practices will be meeting soon to consider all that evidence and come forward with a position for Bermuda. So that is in the works. We will get that soon.
Okay, I'll come back to the figures on the Pfizer's effectiveness, but since June 1st, we've sort of touched on this, but since June 1st, what are the percentage of people who are unvaccinated and vaccinated who've had COVID? I think we answered that already.
Yeah.
Yeah. Okay. So we'll move on. what is the current? We've answered that one. Why hasn't government opened up more testing slots, especially bullshit for COVID, since there are a lot more cases and need to meet the safety requirements? So I looked yesterday, and there was one testing slot open for next Thursday, I believe it was, and then otherwise it was all full until then.
Well, Don, the starting point, I think, is we have to acknowledge that Bermuda is perhaps one of the leading countries that is providing testing for their population. We're certainly in the top 10 with respect to the amount of testing that we're doing on a day-to-day basis. That, as you can appreciate, is a direct correlation with respect to the resources that are necessary, not just the provision of the testing equipment, but also with respect to the staffing that it takes to conduct the testing, as well as doing the analysis from the lab. So I think, we need to acknowledge and be commended that we are doing quite a lot of testing. When we get to circumstances, as we're seeing now, where we have a wave, then there are more persons that are requiring tests, particularly through case management, because I have been identified as a close contact, and we've got 400 and some odd cases at this point, and each one of them, if you can appreciate, may have 10, 20, 30 contacts. If those persons are identified as close contacts, they also have to be tested. So part of our regime is to ensure that we continue testing those persons that are close contacts, recognizing individuals want to get their safe key, particularly for a weekend, and we need to make sure that we have resources available for that. But our first and foremost objective is to ensure that we have sufficient testing operations for persons that are either symptomatic or alternatively have been identified as close contacts to cases.
Okay. The part of the thing is, like, a lot of people who want to use the safe key aren't willing to drive down to St. George's or Somerset to get a test for something they're going to do a week in advance. It's just we're doing a lot more testing, but we haven't opened up more testing slots.
Well, like you said, and I think unfortunately, there is an element of personal responsibility. You started off correctly. People aren't willing to drive to Somerset or to St. George's in order to be tested, and that's a very unfortunate reality. But the reality is, we're 22 square miles, and the availability is there. It's just that you may have to get in your car to drive. I think that if persons want to avail themselves of the testing, then they'll get into their car and drive the 20 minutes, 30 minutes that it takes if they're situated in the central parishes to get their test. The fact is that they are being made available. I'm sorry if you have to drive to Somerset or St. George's to do it, but the availability does exist.
One more SafeKey question. If somebody who's unvaccinated wants to use SafeKey every day, they can't, because it states on the booking site, please do not book more than one test every 4 days. And if we find multiple test bookings for an individual in less than 4 days, your duplicate bookings will be canceled. It seems a bit unfair to them if you're requiring the SafeKey, but they can't use it every day of the week because they can be tested enough.
Right. Those are circumstances that we are looking at to address. The majority of persons that do get the SafeKey are doing it for the weekends. So they're doing it Thursday or Friday so that they can engage in social activities on the weekends. But those are factors that we are looking at. However, unfortunately, this time, as you can appreciate, we are in the midst of a wave. So our priority is to ensure that we have sufficient testing resources available for those persons that have been identified as a case, as well as the close contacts of those persons.
Okay. CMO, I found this study. It was done by the Mayo Clinic Health System, and they found the Pfizer BioNTech vaccine had fallen to 42% against the Delta variant, whereas Moderna had dropped to
for what exactly? What is it? What was 42% represent?
The 42% effect. It says effectiveness of the vaccine had fallen from 42% from 76%.
Effectiveness against what is my question, Don?
Okay. So they're trying to read. Preventing. Well, let's see. Okay, I'll have to come back and I'll have to read again.
Yeah, and Don, again, as you don't look at one study, you look at all the studies that are available.
Yeah, but I've
seen statistics works.
Yeah, I've seen like a lot of studies that have come out and pegged it at between 42 and 46%, though.
Well, if you're talking about all infections, that's probably right. But again, symptomatic infections, that's not correct.
Okay, we want to get into some reader questions here before we run out of time. Last week and possibly the week before, the vaccination status of hospitalized cases were not reported. Have there been any fully vaccinated people in the hospital over the last 3 weeks?
Okay. Minister, may I?
Certainly.
Yeah. So at the moment, the numbers are very small, and we have announced that this will be provided on a monthly basis. So later on today, there will be graphics released with the data on a monthly basis, talking about hospitalizations and their vaccination status. The numbers are small. We don't want to inadvertently release people's confidential medical information.
Okay. What percentage of the 12 to 17 age group is vaccinated? This statistic is key to how policy can be shaped, and to my knowledge, it hasn't been shared publicly. Again, that's another reader question.
Okay. Yeah, it's that I would need to look at that. This we discussed this at the start of the meeting. We would not be able to give you the full details on that because that's a very specific question. We don't report that routinely. However, what we have suggests that age group between 10 and 19, we have about 40% of that age group already vaccinated. So for the specific group that you're looking for, I don't have that at hand.
Okay. Will the health minister consider quarantining the vaccinated until after their day 4 negative tests, seeing as though unvaccinated persons are going straight into quarantine?
Thank you, John. As the CMO has indicated previously, as well as this is supported obviously by a lot of evidence and scientific data, persons that are vaccinated do have a less likely ability of transmitting the disease to other individuals as opposed to individuals that are unvaccinated. When you look at the statistics here in Bermuda, 3/4 of the persons for local transmission, or 60% of something of persons that have local transmission of our local transmission are all unvaccinated individuals. So the government's decision to use of quarantine facilities for individuals that are traveling to Bermuda and the like was based on that scientific evidence and the issues that I spoke about concerning minimal transmissibility of persons that are vaccinated versus persons that are unvaccinated.
Okay. And I noticed, and I didn't see this before, just to piggyback off this, there seemed to be a lot of vaccinated people testing positive on day 10 from yesterday's report. And I don't know if that's a new or recent trend.
Well, I do recall from yesterday's report, there were a number of persons that were testing positive on day 10. It's interesting because the way our statistics are showing, the majority of persons that are importing the coronavirus, COVID, are persons that are immunized, principally because the majority of persons that are traveling into Bermuda are immunized. But then reversely, the majority of persons that are spreading the disease within the community local transmission is by persons that are unimmunized.
Okay. Another viewer question here. Why are we worse now with 65% of the population vaccinated than we were a year ago?
Done 2 words. Corona variant. Sorry, it's the Delta variant. It's a much more transmissible variant of this virus. If we had the same variant last year, then things could have been a lot worse.
Yeah.
So what we're seeing at the moment is because of the protection that we have been able to get from 65% of our island being vaccinated.
Okay. Now, I know there's another viewer question. I know the government's said this a few times, but why isn't every registered healthcare professional, staff, or contract worker in healthcare facilities and schools, teachers, staff, contract workers mandated to get vaccinated?
Like you said, Don, from a government's perspective, we have indicated that we would not be looking towards mandatory vaccination. However, it does not preclude an employer depending on their contractual arrangements with their employees, to make that said requirement. I know that we've been having discussions with employers who've asked a similar question, and that's obviously a matter for them concerning whatever their obligations of employment are on the contract. But government has indicated and gone on record that at this point we would not be looking for mandatory vaccination for government employees.
Can you say roughly about how many employers have asked that?
It comes up regularly. We meet regularly with Employers Council as well as the chamber, and there have been questions where particularly employers who have found that they are having a number of outbreaks and so forth, and they want to do what they can to guard against it impacting adversely their business, and they have made those type of inquiries.
Okay. Do you know of anybody in Bermuda who's done that? Made that a requirement yet?
There must be hundreds of employers, so I wouldn't have that information. I don't know.
Okay. Another viewer question: can we return to daily case count and updates now? I think this person was mostly concerned because the numbers are reaching higher over the last few weeks.
If you can appreciate, and I can appreciate that viewer's concern. However, regrettably, the teams are extremely stretched, and when we made the decision to do reporting twice a week several weeks ago, that was following 16 months of daily reporting. And again, the teams are stretched. It takes quite a lot of human resources to calculate all of the data, as well as for producing it in such a mechanism or a manner in which it can be publicly disseminated. And so at this point, we will continue with our twice weekly reporting, which we think is sufficient in the circumstances.
We haven't. I know, like in the U.S., there were studies done before Pfizer vaccine got approved, and it suggested like 1 out of every 3 people or 3 out of 10 people would get the vaccine after it reached approval. But that doesn't seem to be the case there, we haven't seen any real uptake in people getting the vaccine after the FDA approval here. Why do you think that is?
I don't know. It's hard to say. I mean, we will continue with our education surrounding the importance of immunization. We will continue to encourage members of the public to get immunized and to ask questions of their physician to make sure that they make the best informed decision for themselves and correspondingly to the community, for the community.
Okay. Now, there have been some concerns in the community with regard to the Lambda and Mu variants. If the CMO can explain what those are and, a variant of concern or a variant of interest between the two of them.
Well, at the moment, I think both Lambda and Mu are variants of interest, and these are things that have the potential to cause public health issues. So at the moment, they are not variants of concern. They are not as widespread as the Delta that we're dealing with at the moment. But we're part of an international community, and these things have been monitored globally. Fortunately for us, we have not seen any of those weird and wonderful variants yet. Fingers crossed we wouldn't if we all take the right measures and stem this tide of positive cases that we're getting.
In your opinion, I know this is just a guess, have we reached peak yet with the Delta variant?
No, I don't think we have.
Okay. When do you think that might reach peak?
Well, you're asking me to guess how long is a string of piece? How long is a piece of string? No, you can't say this. There's so many variables that will affect whether or not we peak. And probably the most important thing is if we all take the multi-layered approach to preventing this, then we can actually stop this. So if we've talked about vaccination several times, that's the most important thing you can do to protect yourself. Aside from that, it's important to continue to wash your hands regularly, and if you can't use hand sanitizers, cover your face with a mask, especially when it's impossible to physical distance. That is crucial, and avoid crowded places. Those things are as simple as it sounds, can actually break the transmission.
Don, if I can add to that, do you mind if I add to that, Don?
Sure, go ahead.
The CMO is spot on. What we're also finding, unfortunately, is that people are going to work ill. If you have any type of symptoms or if you're not feeling well, then you need to stay at home. And that's unfortunately helping to spread this because people are deciding to continue with social activities and or going to work when they clearly should not be because they're not feeling well. So if you feel sick, stay at home.
Okay. Possibly one last question because we're running short of time here. There's a lot of misinformation in social media about COVID. How do you deal with that?
We rely on people such as yourselves to assist us in getting the proper, correct messaging out. Assist us in telling the members of the public, go to reliable sources, speak to your doctor, look at sites that are reliable. Look at the government website. The government website has a plethora of information concerning the guidance of COVID, what to look for, the symptoms, etc. You have to use reliable sources. Some of the things that people are relying on YouTube and so forth is not reliable. You need to actually do the research and use reliable sources and speak to your physician first and foremost insofar as getting the proper answers to the questions so that you're not relying on false information, which of course is, in abundance.
Okay, this is for both of you. What is probably the most common, in your opinion, the most common piece of information that is out there? And the second part is, what's the most ridiculous thing that you've seen?
How many minutes left do we have?
Three, 2.5.
I don't know. Minister, I don't know if you want to start. There are too many examples to choose from.
I don't know where to begin.
Well, I suppose personally for me is that I'm being paid by Bill Gates or George Soros or whoever you choose. The flavor of the month is to pass on this disinformation to everybody. A doctor of 22 years experience and a specialist for 12 cannot think for himself. He needs to be told what to think. I find that extremely laughable.
Yeah. Well, if it makes you feel any better, I've been accused of taking money from Big Pharma. Health Minister?
Probably is similar to what the CMO says. I actually have a chip in my arm, so I'm not taking money. I've got a chip. That's why.
You might want to put a caveat on that because somebody's going to be clipping that just little segment.
That was an example, exactly. Yeah, I think that if I could just end, Don, by repeating what I said a few moments ago, there's a lot of misinformation out there, and I think we have a personal responsibility to educate ourselves. And by that I mean go to the reliable sources. Like I said, the government website has a lot of information, as well as your doctor. If in doubt, ask your doctor so that you can make a proper, informed decision as to what's best for you, your family, and the community, but based on practical information and knowledge that is actually reliable.
Thank you. And CMO, do you want to finish off with anything? Any last word from you?
No, I think the minister said it all. You need to question everything you hear. And when you say you've done your research is not a few minutes in front of Google. It's not listening to YouTube. Research is a lifelong thing that people dedicate their entire lives doing. And that's why we say go to respectable sources, because they have looked at all the evidence, they've checked all the references, say that this actually what is actually telling you what the conclusions have been given is exactly what the research says, and they pull everything together with what is biologically possible and then tell you this is our recommendation. This is why we're asking people to go only to trusted sources. Checking, doing a few minutes on Google isn't research. That is only feeding your confirmation bias.
Yeah.
Okay. All right. Appreciate your busy time. I know you said a strict 30 minutes.
Yeah.
We want to thank Health Minister Kim Wilson and the Chief Medical Officer, Dr. Ayoola Oyinloye.
Thank you.
And appreciate your time and your work for Bermuda.
Thank you.
Thank you, John.
On behalf of Burn News, I've been your host, Don Burgess, and as always, we wish you a beautiful afternoon.